Hello, Mrs. Smith. My name is
Hi.
Mary. I will be your nurse for today. Let me go ahead and perform hand hygiene. So it looks like, I'm just going to go ahead and scan my badge. So it looks like upon the orders, we have a urine specimen to be collected from your Foley. Is that okay for me to do with you today?
Yeah.
Okay, I'm just going to explain a little bit about the procedure. I'm just going to go ahead and clamp the Foley tube for about 15 minutes because we can't use the urine that's already in the bag because we don't know if other bacteria has invaded, and then test results will be inaccurate. So we're just going to go ahead and do that, and I'll be back, and it'll be an easy process, no pain. You don't have to do anything, but just focus on voiding, okay?
Okay.
Okay, I'm going to go ahead and wash my hands, and I'm going to collect my supplies. Alrighty, I'm going to raise you up in bed a little bit. Okay, I'm just going to go ahead and expose only what's necessary, okay? So I'm going to go towards the bifurcation section. I'm going to go ahead and sanitize my hands, and I'm going to put on some gloves. Okay, then these are clean hemostats, and I'm just going to go ahead and do it right below the bifurcation, and I'm going to clamp. Alrighty, 1, 2, 3, okay. I'm going to leave this right here with you for about 15 minutes, and I will be right back to collect a sample, okay, Mrs. Smith?
Sounds good.
Alrighty, I'm gonna go ahead and remove my gloves, and I'm gonna lower you up in bed, and I will be right back, okay?
Okay.
Is there anything that I can do for you in those 15 minutes?
No.
Okay, I'm gonna go ahead and set a timer, and I'll be right back, okay?
Okay.
Okay, I'm gonna sanitize my hands, document that I put the hemostat. I'm gonna assimilate that I left. I'm coming back, and it has been 15 minutes. I'm gonna go ahead and sanitize my hands. Alrighty, Mrs. Smith, how are we doing?
Good, you?
Good too. So it has been 15 minutes. I'm gonna go ahead and I'm gonna collect that urine specimen from you, okay?
Okay.
I'm gonna go ahead and grab a pair of clean gloves. And before I put that on, I'm gonna go ahead and sanitize my hands. Then I'm gonna raise the patient up in bed. Alrighty, Mrs. Smith, I'm gonna go ahead and raise you up in bed. Remove that call light. Okay, I'm only gonna expose what's needed, okay? Alrighty. And I'm right here at the bifurcation site. And before I go ahead and I clean and I do everything, I'm gonna go ahead and open my cup, making it easier. Go ahead and open my syringe, have my patient label, and my alcohol pads. I'm gonna go ahead and sanitize the hub for at least 5 to 15 seconds. Alrighty, I have that all set up. I'm gonna go ahead and grab my lure lock to collect the sample. Go ahead and insert that, and insert as I need, and it looks like I need 10 mLs of urine. Alrighty, have that collected. I'm gonna go ahead and make sure I set that into my container, making sure the tip does not touch the inside of the container and the specimen remains in. Alrighty, I would go ahead and dispose of this in the biohazard bag. I'm gonna go ahead and open another alcohol pad. Then I'm gonna go ahead and sanitize for 15 to 60 seconds. I'm verbalizing that. And then before I take my sample out, I would let my port dry. So I'm also gonna verbalize that I would have let my port dry before I collected my sample. I'm gonna go ahead and continue with disinfecting after sample collection. And that is now clean. I'm gonna go ahead and unclamp that. Alrighty, making sure that urine is still flowing, and it is. Go ahead and cover my patient up. I'm gonna go ahead and cover my specimen and dispose of this in proper receptacle. Alrighty, Mrs. Smith, so I have printed a label before I go ahead and stick it on the urine specimen. Can you confirm with me that this is your name and date of birth?
Yes, ma'am.
Alrighty, awesome. I'm gonna go ahead and stick that onto the urine specimen. I'm gonna set this aside, and I'm gonna take off my gloves, throw away my garbage, and go over in bed. And I would perform hand hygiene once I take off my gloves, of course. Alrighty, Mrs. Smith, do you have any questions?
No, ma'am.
Alrighty, I will go ahead and send that off to the lab and we'll see what those results say, okay?
Okay.
Okay, I'm gonna perform hand hygiene and go document. Oh, and also, I'm gonna leave the call line right here if you need anything, okay?
Sounds good.
Okay, I'm gonna perform hand hygiene and go document.
Okay.
And thank you, Mrs. Smith. I'm gonna go ahead and take this off to the lab, and this would be in a biohazard bag.
Thank you.
Mm-hmm.